Hello everybody. So today 2nd of December Tuesday we are going to see major news articles with respect to the mains. Okay, so we have two very good articles with respect to mains today. Okay, so the first article which talks about the need for heart resilient urban planning, it actually links the cardiovascular diseases upsurge, okay, and the urban planning, relation between the urban planning. Okay, in broad you will see that the association between the health, okay, and the urban planning. Okay, we are no alien to the fact that our urbanization is not at all sustainable. Okay, and major cities in India are the most polluted cities in the world. Okay, and you will see that this will have not only effects on this generation, this will also have effects on the coming generation. Okay. So, now that being said, let us go through this article and what it actually says. Okay. Before we get into this article, we see that there are a couple of UPSC previous year questions which are asked with respect to urban planning, and it is very important. Okay. So, now see, now urban planning in India must deliberately reduce the cardiovascular risks by designing walkable, green, equitable and health centered cities. Okay. So, now this is very important, because if you are not integrating the component of health in the urban planning, our urbanization will never be sustainable. Okay. And this article actually introduces in that way only, that on the World Habitat Day, okay, on the World Habitat Day, the how Indian cities habitat is actually progressing and it is sustainable or not. Okay. Our daily urban stresses such as long commuters, polluted air, shrinking green spaces and limited healthcare access are driving a sharp rise in the heart diseases in Indian cities with higher prevalence than rural areas. Okay. You need to understand that even though COVID took away many lives, okay, it was very big event with respect to human history, okay, in India, but you need to know that cancer, cardiovascular diseases and non-communicable diseases such as hypertension, BP, which is BP, and diabetes, these diseases are also equal contributors for the high amount of deaths in India. You will be surprised to know that around 31% of India's deaths are occurring due to cardiovascular diseases. Now, where according to recent estimates, according to 2011 estimate, 31 to 32% of Indian population resides in urban cities. According to recent estimates, it is stated that 36.6% of Indian population resides in urban cities. When the urbanization is growing, you will see the economic growth is growing, and along with that all the allied activities are growing, and along with that you will see that the environment is being destroyed. With the environment being destroyed, the effects are on soil, water and air, okay, which are very essential for our human survival. Okay. So, when these are polluted, you will see that the development of the urban city is very unsustainable. Okay. That is what this article talks about, and it states that the urban versus rural difference, the incidence is 11% more in the urban areas with respect to rural areas. See, cardiovascular diseases might be natural, they are also called as lifestyle diseases, but the effect of urbanization, unsustainable urbanization on the occurrence of the cardiovascular diseases is where the major difference is. With the urbanization, you will see that your workspaces are somewhere else, okay, and before in the rural areas the workspaces are very near, which is their fields. They have to go by walk, they have to bicycle, bullock cart or something, and the more amount of physical exercise was needed. But with the urban spaces, what is happening is that you will have to take your vehicle, or you will have to commute in a public transport, and these transport that you are using is very unsustainable. Okay. And the vehicular pollution, Delhi actually suffers from vehicular pollution. Hyderabad, Bangalore is a special case where the traffic congestion is very much. To travel from one part of the city to the other part of city, it might take the same time or even more to actually reach the city from different city. Okay. So, now all these factors accumulate and they will increase the incidence of the cardiovascular diseases. And also you will see that there is a healthcare gap. Okay. Now, what is a healthcare gap? The expensive care remains inaccessible, millions lack preventable healthcare services. Okay. For a highly earning individual, it is very easy to get medical health attention, but a daily wager or a menial worker, when he or she gets such diseases, to overcome the disease and to get treated for that disease will become a humongous task. Okay, it is very heavy on the pocket. According to estimates, one hospitalization will take somewhere around 35,000 of money from your pocket in India. Okay, this is the estimate. Okay, so now 30,000 for a daily wage laborer who is barely surviving on the basic needs will be very tough. It will push them into poverty. Okay. One of the causes of poverty is not being able to manage the health itself. Okay. So, yeah, and now the India state level disease burden study shows that 23% of rise in the cardiovascular cases in the urban regions. Okay. And now the key elements of healthy urban planning. Okay. So, this article actually talks about what are the causes, what exactly is happening, and it suggests that what can be the key elements of heart healthy process. First one is the active mobility. We seldom walk, we seldom रैपिडो आ गया, रैपिडो ले लिया, ऊबर आ गया, ऊबर ले लिया, यहाँ से वहाँ जाने के लिए, कूड़ा कचरा फेंकने के लिए भी what we will do, we will, these days the people are booking Rapido. Okay. So, the utilization of technology shouldn't subside your own physical exercise. Okay. The more you are not immobile or more you are less mobile, the body is actually so the body is actually meant for moving. The body is actually, the legs are meant for walking. Okay, hands are meant for lifting some weights and doing something. If you are not doing that, the fat accumulation will occur, and that will again lead to one more thing, and that will lead to the lifestyle disease, and hence this is called as lifestyle disease. To overcome this, we need to have the walkable neighborhoods, safe cycling routes, mixed land use development. Okay. And next one is the green infrastructure. There in the urbanization, you will see shrinkage of green infrastructure. Okay. So, the parks, tree cover, community gardens, and reducing the stress, pollution and urban heat. Okay. Urban heat island is a very important and also very interesting phenomena, where you will see that till wherever the urban area is there you will see the sudden or increased level of temperatures. Okay. And once you get out of that dome, you will see the reduction in the temperature, and one of the major important reason for that is the high rise buildings. Okay. No water bodies, there are no carbon sinks. Okay. There is no way you can actually the cooling of the area cannot happen. Okay. And the air gets trapped because of high pressure, ऊपर आ जाएगा, and the air gets trapped, and that will actually lead to a vicious cycle of urban heat, and that is the reason why it is called as urban heat island. Okay. And whenever summer comes, you will see that most of our urban cities will go through this urban heat island effect. Next is the affordable, accessible, clean transport reducing commuters' stress, such as MRTS. Okay, mass rapid transport systems. Okay, mass rapid transport system which include EV buses, metro rails. Okay. So, these sorts of sustainable, these sorts of less polluted transport systems are very much required. Okay. So, now it also talks about the implementation framework. Okay. Now, what are the pillars for the transformation? First one is the policy integration. We need to align with the WHO, National Urban Health Mission, Smart Cities Mission and other frameworks. Okay. So, now the cardiovascular diseases is that comes under the health. Now, health is not an isolated subject that needs to be dealt isolatedly. If you are present in an urban space, that has to be dealt in an integrated format, and that is called as the policy integration. Next is the community participation, which is co-designing with residents and conducting equity audits, which means the participatory policy framing implementation. Okay. And next is the data driven planning, where you have to monitor the health outcomes and track progress via digital tools, and there needs to be a multi-sector collaboration where engage academia, research, NGOs and government agencies, so that the data, the policy implementation, the reviews, okay, and restructuring can be done properly. Okay. So, this is how the implementation framework needs to be done. Okay. So, now the success models. So, wherever you see the implementation is done right, you will see good amount of results, such as Delhi cycling routes are there. Okay, not in the central Delhi, you will see in the outskirts of the Delhi. Okay. And now green certification programs, where the parks projects reducing the pollution displacement through which are meant for the equity matters. Okay, which means that if for example, now if you are going to buy some land, or if you are going to buy some house, if that house has green certification, and then that is a environmentally sustainable one. Okay, this can be implemented. And next is Surat's transit linked neighborhoods, where you will see that all the different areas are actually linked by the mass rapid transport systems. Okay. And also you will see that the Asian Developmental Bank invested 305 billion investment for the urban health embedded in developmental agenda across India and Asia. Okay, you can use such funds. Okay. Now, India is at a turning point because affordable healthcare burdens and burdens the millions, but through deliberative, inclusive urban design, we can build cities where health is accessible, healthy choices are easy and communities thrive together. Okay. So, whenever a mains question is asked, you have the data points where 36% of urban population is actually right now under the 36% of the population is under urban areas, in the urban areas, and the cardiovascular disease incidence is somewhere around more than 20 odd percent, 24%, and the rural to urban difference is around 11%. Okay. So, And we have I have already discussed with you important case studies such as Delhi cycling and Surat interconnected mass interconnected areas. So these sorts of arguments you can actually frame. Okay, and to see India as a developed nation, to see India as a better place for living, these all areas have to be worked upon for getting a sustainable living. Okay. Now this completes our article. Let us discuss our next article. So the next article is about the it explains the extreme poverty, which is, it states that it has fallen, but there is a stagnation in the growth and how the dynamics of the extreme poverty is being shifting, okay, across the globe, and it sees the correlation between the economic growth and the extreme poverty, okay, and how it can be tackled. Okay. So now these are a few questions that UPSC has asked with respect to poverty, okay, and I want you to just try to brainstorm, okay, and after this this article discussion you will have much more clarity on this. So what exactly it says? It says that the extreme poverty has fallen by about 1.5 billion people since 1990 to somewhere around 730 million. Okay. So in 1990 world had 1.3 billion people under the extreme poverty, which has right now fallen to 730 million. Okay. And most of the world's extremely poor right now are in the sub-Saharan African countries. Okay. So now there are a few graphs in this article. Okay. Now so the first there are few charts that this article has given, and in this chart, the first chart, it's the share of population in the selected countries who are living in extreme poverty versus the GDP from the 1990 to 2024. Okay. So now you will see that the share of extremely poor people in China went down from 80% in 1990 to 0% in 2024. Okay. And also this is also the same case with the Indonesia. Okay. It also had the same amount of population, okay, same amount of population under the extreme poverty. And now the correlation with the GDP is that now China's GDP has increased from around 1,600 in 1990 to more than 20,000. Okay. On the other hand, this is also different with respect to different countries over here. Okay. And you see in the Southeast Asian countries, the condition is also same, where India, Pakistan, Bangladesh, Philippines, okay, these countries So now these countries have also seen the absolute reduction in the number of poor people, okay, absolute poverty people. Okay. Now the reduction before from 1990s to 2000s, we saw that the tiger economies of Southeast Asian countries, okay, they grew very fast, okay, except for a brief period between they had a crisis because of opening of their economy completely. Okay. Now because of the capital account convertibility, they had a few issues, except for that Southeast Asian countries were very good, and India has also made sure with so many welfare programs the condition of absolute poverty is reduced. Okay. Now, the most poor people, which under most people under the absolute poverty, has now shifted from the Southern East Asian countries, which was the once condition in 1990s, to sub-Saharan countries. Okay. Now, and it might also increase. That is what the article is right now talking about. Okay. So, now the extreme poverty is expected to remain stagnant or increase, which means by 2050 you will see that 793 million will be under the extreme poverty, and countries not graduating from low income status face slow GDP per capita growth. Okay. So, now let us talk about the correlation between this. The countries where the growth is stagnant, okay, we saw that the Philippines and China, Indonesia and China actually, they have seen consistent GDP growth, okay, and their growth was not stagnant, and because of this what happened was they were able to pull out people from the extreme poverty. On the other hand, countries whose GDP growth is actually very stagnant, you will see that more people are pushed into the poverty. Okay, that is what the correlation is all about. Now, it talks about the sub-Saharan countries. 50% of globally extremely poor are in sub-Saharan countries. Okay. On the other hand, 40% are in South and Southern Eastern Asia, and rest of the world you will see that the 10% are there. Now, the key countries stuck in the poverty are Madagascar. It says that it shows that the example of Madagascar and the DRC and also Central Asian sub-Saharan countries, where Madagascar was able to remove people from the poverty during early 1990s, but once its GDP growth reached a point of stagnation, okay, it was not able to remove people from the poverty, and in turn more people are getting into poverty. Okay. That is what it is talking about. Now, what is the developmental trap? Okay, where you will see that the pattern, as a country grows from the low income, the poverty naturally falls and incomes becomes everyone's shared platform. Okay. And now the wherever the country's growth is being stagnant, you will see that the poor are not being lifted up from the extreme poverty. And now it gives the example of stagnation such as Madagascar, whose 1990s GDP per capita was 850, and recently you see that it is under 500, and this is also same case with the DRC. And why? See, what exactly happens is that the inflation is rising, supply chain issues, bottlenecks you will see. Okay. And during this time, now when the income is not going, when the GDP rate is not going, the GDP is not growing according to the required rate, the tax base, weak institutions and population growth, obviously next important thing is the population growth, you will see that all these things will act as a choke point and pressure points on the GDP growth. Okay. And the income distribution will become skewed. When the income distribution becomes skewed, you will see the rise in poverty. Okay. So, this might occur. Fine. So, now how to break this trap? Okay. Now, breaking this trap will require the essential actions such as economic growth in the poorest nations, equitable redistribution, infrastructure and institutions. Okay. Now, for the economic growth and development, you require very important factor, that is the structural transformation and diversification beyond agriculture and industrialization and the area focusing on the areas where the real job growth is more, okay, that is manufacturing sector, industrialization, okay, mass job growth should be done, okay, that will give the GDP growth and it will have a spillover effect on the per capita GDP growth rate, okay, not just the growing of GDP is important, but per capita growth rate is also very important, okay. Now next thing is the infrastructure. So the world is going, the country should also be in pace with the world trends. Without better infrastructural facilities, the growth and development will see very minimal growth, okay. It talks about roads, electricity, digital access, transparency and governance, and with these all things actually improve the ease of doing business, they will attract investments, okay, and consequently you will see the growth and development. Next, now once these are all created, you will see that the progressive taxation, okay, where not only the rich will get richer, but the trickle down effect of the money that is created is to be taken care of, and which will include the social safety nets, universal health, education and poverty reduction. So these are a few solutions that this article tries to offer, okay. So again we need an agile, integrated, equitable, sustainable solutions brought into place, where the international organizations such as UN and regional organizations such as BRICS, G20, these all can actually go forward and take care of the eradicating of the extreme poverty, okay. So I hope that you have got good information from this, and I hope that you have a great day, okay. Make sure that you do every moment that you are studying, every moment that you are living makes count. Thank you so much.